Hi there, it's Dr. Kathleen Cannon, and we're back today with the vitamin alphabet talking about vitamin B7 or biotin. Yes, biotin. Biotin is a B vitamin, and it's really well known as being the hair, skin, nails vitamin. So yes, biotin is involved in your hair, skin, and nail health. Yes, definitely. It's also involved in other processes in your body that you may not know about, that aren't talked about quite as much. It's involved in your gluconeogenesis, or how your body gets sugar energy. It's also involved in amino acid catabolism and fatty acid synthesis and other metabolic processes. Biotin is also involved in your immune function, and it's involved in your hormonal pathways. In addition to that, it's a cofactor in a lot of different pathways, mechanisms that happen in your body every day. Deficiencies in biotin, one of the most common early symptoms can be a change in your hair, skin, and nails, and also in your immune function. Now, those early symptoms of biotin deficiency are not specific to biotin. There are many conditions and deficiencies and other factors that can cause those. So just because you have a change in your hair health does not mean you have biotin deficiency, but it's something that we consider when we're looking at the whole person in naturopathic medicine. So deficiencies in biotin can be caused by a low intake of biotin. It's not found in a lot of foods, so a low intake could be a cause. Genetics can play a role, and also your gut microbiome can be a factor. Your gut microbiome is where biotin is absorbed, as are many nutrients. It plays a role in how your body absorbs the nutrients, I should say. Your gut microbiome is actually all of the bacteria that live in your gut. So it's like a whole microbe, a bacterial world in your gut. And it's really beautiful and amazing, but it plays a role in how your body can absorb foods. And then in addition, biotin can be produced by some of the bacteria in your gut. So when your bacterial or your microbiome is affected, it's going to affect your biotin status. So whenever you have changes in your microbiome caused by things like antibiotics, which is pretty common, and also things like stress, environmental toxins, certainly the food you eat, all of these different factors can impact your microbiome. So it's another thing that we want to think about. How to find out if you're actually deficient in biotin is through testing. And there is a readily available blood test for biotin. However, it's not really that accurate. A much better indicator of your body's B7 status is to do a functional urinary test, where we look for a biomarker that's more specific to biotin to get an idea of what your body's biotin status is. Now again, biotin is not found in a lot of foods, but the foods that it is found in include egg yolks, kidney and liver, salmon, oysters, and certain cheeses. So really not a lot of foods there, where some of the other B vitamins are found in many foods, like B5, for example, that we talked about recently. B5 is found in virtually all foods. B7, not so much. It's much rarer in that sense. If you supplement with biotin, it's important to take it with food because it is water soluble. And really the best way to supplement with biotin is to take the biotin with other nutrients that are synergistic, because they help the biotin to act, but the biotin also helps them to act. So taking biotin with other nutrients is important. None of this is a recommendation for you to take biotin. Always check with your provider before changing anything, especially making big changes in your supplements, your diet, etc. I hope you found this interesting and informative, and may you be well.